And action! Sam had a question about Pap smears. Pap smears, or Papa Nicolau smears, are the way doctors check for cervical cancer. When we do that Pap smear, it essentially involves checking the cervix. This is my father's model. He's an OB-GYN, and my father's model that he used to teach his patients with. So this is the cervix right here. Let's see if you can see it. So down there's the cervix. This is the uterus, and these are the fallopian tubes in the ovaries. So the ovaries are where you let go of an egg one side or another, alternating months, and they go down the fallopian tubes until they get to the inside of the uterus, and the sperm meets the egg in the fallopian tube. It impregnates on the uterine wall, and you have a baby in 9 months. So the objective is sometimes out of the ovaries, out of the uterus, and out of the cervix, which is the conduit or the connection to the outside world, sometimes will wind up with cervical cancer. That is because the cervix, it changes its epithelial lining, its surface rapidly, mostly because it's exposed to external trauma. And that'd be intercourse, tampons, bacteria. And when it's exposed to external trauma, it fixes itself. It gets damaged, it fixes itself, it gets damaged. With that rapid turnover, you have the chances for cancer to be in during the time, one of those times of repair. When a small cancer develops, you want to catch it early. How do we catch it? Well, we usually will again, this is the vulva and this is the vagina. This is what I would see if I'm doing a Pap smear. This is a speculum. Usually what we do is we insert this into the vagina, we look at the cervix that way, and we use these two things. This is soft, it's pointy, but it's nice and soft. We use these two things to check and swab the cervix. So if you swab the cervix, put it on in a bottle that's called a thin prep pap, and you swab the cervix, put that in a bottle called a thin prep pap, you send that off, and it's spun down, and the doctor will look at the cells and look for cancer. As you get older, obviously we have a variety, just to let you know. We have a variety of different speculums. They used to be metal. My father had metal speculums that he would put in a cleaning machine and we'd redo them or reuse them. You know, as far as I'm concerned, they were probably passing on bacteria. That's where all doctors did that. Autoclave machines are supposedly good enough to kill everything, including viruses, but I truly think that metal passed on bacteria, virus, fungus, or something. This is better. Obviously, they didn't have the plastics back in the 60s and 70s, but this is better. These are different sizes of speculums, so we have to put this in, kind of open it up, and we kind of see what we can see. That's what the view is. Versus this one. This is more of a younger person. We actually have a virginal one too. It's very small, but we have to kind of do expansion a bit. Sometimes the vaginal wall is a little floppy from having kids or from weakness in the pelvis. So we might have to spread it a little bit to see things. And then again, after getting a good peek, we will usually swab. There's no pain with this. Then after all that's done, it's also time for an internal exam. Internal exam is when we go to feel how big these ovaries are on each side. So usually we'll try to feel one hand in, 2 fingers inside and one hand on the belly, and press and bring the ovary close to the other hands, or try to get a feel for the one side and then another side. And that usually tells us whether there's an enlargement of the adnexa or not. Sometimes polycystic ovarian syndrome will be painful on one side. Sometimes an ovarian tumor will be obviously enlarged. If that's enlarged, then we go on to order an ultrasound of the pelvis. Ultrasound is when you get a wand, an ultrasound wand at the hospital, and they get an ultrasound, which is sound waves, a picture, ultrasonic picture of the uterus and the ovaries. Tells us a lot about the thinness of the cervix, thinness of the uterine lining, how big the ovaries are, if there is any other foreign bodies or problems. All that information tells us that you're good for a year, do not come back, or good for 3 years, see you then. So that's essentially what happens with a Pap smear. The question is also, if you're not sexually active, do you need a Pap smear? And yes, again, going by the standards 21 to 65. If I have a younger person that's sexually active, I would get them in anyway because I think they need counseling. So young women 16 to 21 that require birth control, I would always say you have to get into the doc's office and consider a Pap smear. Now, will it do anything with finding cervical cancer? No. But I think it's a good idea to start looking for chlamydia and gonorrhea if you're sexually active. And a lot of my young people say no, and then we get a pregnancy test and they're positive. Or they say, I've never been sexually active, and yet we have vaginal discharge, positive for chlamydia. So it's commonplace for young people to be very embarrassed, so they won't tell us everything. But sexual activity, I think you have to be responsible enough to get in once a year to the doctor's office. And the other part of going to the doctor's office is not just to do physical exam. That's 1/4 of the exam. The exam that makes the most effort is to have the bonding between doctor and patient. Once I can be trustworthy to a patient, then I'll be the sounding board for other things as they get older or as they go through the decades of life. If I am not trusted, or if they don't know me except for seeing a doctor and getting blood tests done, they're not going to confide in me. They might not we're talking about young people, they might not at the right time confide in their parents. They might confide in people in the class. That's not always the healthiest thing, or a significant other, which is not always the healthiest thing either. So that's another reason, rapport, bonding, trust, to get people in earlier than 21 for annual checkups. So Sam, good question. Hopefully this helps. Don't forget, if you're undecided, please get into doc's office. It's totally normal to feel uncomfortable with a man, but get in to see a female gynecologist. Whoever it is, get in, evaluated, get out, get done.